What are skin diseases? Skin diseases, also known as dermatological conditions or dermatoses, refer to a wide range of medical conditions that affect the skin. The skin is the body's largest organ, and it serves as a protective barrier against the external environment. Skin diseases can manifest in various ways, including rashes, redness, itching, swelling, dryness, and changes in skin color or texture. These conditions can be caused by a variety of factors, including infections, allergies, autoimmune reactions, genetic predisposition, and environmental factors. Treatment for skin diseases depends on the specific condition and its underlying causes. It may include topical creams or ointments, oral medications, lifestyle modifications, and, in some cases, surgical procedures. Dermatologists are medical specialists who diagnose and treat skin diseases, and they can provide guidance on managing and treating these conditions effectively. It's essential to seek medical attention if you suspect you have a skin disease to receive a proper diagnosis and appropriate treatment. What are the most common types of skin diseases? The most common types of skin diseases or dermatological conditions include acne. Acne is a widespread skin condition that primarily affects adolescents and young adults. It involves the formation of pimples, blackheads, whiteheads, and sometimes cysts on the skin, typically on the face, neck, chest, and back. Eczema, dermatitis. Eczema is a group of inflammatory skin conditions characterized by itching, redness, and the development of dry, scaly, or oozing patches of skin. Atopic dermatitis is the most common type of eczema. Contact dermatitis. This condition occurs when the skin reacts to substances it comes into contact with, leading to redness, itching, and rash. Common triggers include irritants like soaps and allergens like poison ivy. Psoriasis. Psoriasis is a chronic autoimmune skin condition that results in the rapid buildup of skin cells, leading to thick, red, scaly patches on the skin. It can affect various parts of the body. Rosacea. Rosacea causes facial redness, flushing, visible blood vessels, and sometimes the development of pimples and swelling, primarily affecting the central part of the face. Skin infections. Bacterial, viral, or fungal infections can cause various skin conditions, including cellulitis, impetigo, cold sores, and athlete's foot. Hives, urticaria. Hives are raised, itchy welts on the skin that often result from an allergic reaction or other triggers. Skin allergies. Allergic reactions can lead to contact dermatitis, hives, or other skin symptoms when the skin comes into contact with allergens. Basal cell carcinoma. This is the most common form of skin cancer, usually caused by excessive sun exposure. It often appears as a shiny, pinkish bump or a scaly, brownish patch. Squamous cell carcinoma. Another type of skin cancer, squamous cell carcinoma, often manifests as a red, scaly patch or a sore that doesn't heal. It's also linked to sun exposure. Melanoma. Melanoma is a less common but more aggressive form of skin cancer, characterized by the development of unusual moles or dark, irregularly shaped spots on the skin. Vitiligo is a condition in which patches of the skin lose their pigment, resulting in white or light-colored areas. It can affect any part of the body. Lupus, systemic lupus erythematosus, SLE, is an autoimmune disease that can affect the skin, causing rashes and lesions, among other symptoms. Shingles. Shingles is caused by the reactivation of the varicella zoster virus, the virus that causes chickenpox, and leads to a painful rash with blisters, often occurring in a specific pattern on one side of the body. Ichthyosis. Ichthyosis is a group of genetic skin disorders characterized by dry, scaly skin that resembles fish scales. These are some of the most common skin diseases, but there are many other dermatological conditions that dermatologists diagnose and treat. The specific treatment for each condition varies, and it's important to consult a healthcare professional for an accurate diagnosis and appropriate management. What are some types of rare skin diseases? Rare skin diseases, often referred to as orphan or uncommon dermatological conditions, are characterized by their infrequency and may be challenging to diagnose and treat due to their limited prevalence. Here are some examples of rare skin diseases. Epidermolysis bullosa, EB. EB is a group of genetic disorders that cause the skin to become extremely fragile, leading to blistering and skin erosions even with minor friction or trauma. Harlequin ichthyosis. This is a severe and rare genetic disorder that results in the skin forming large, diamond-shaped scales. It is present from birth and requires intensive medical care. Pemphigus vulgaris. Pemphigus vulgaris is a rare autoimmune disorder that causes painful blistering of the skin and mucous membranes, often starting in the mouth. Gorlin syndrome, Nevoid basal cell carcinoma syndrome. This rare genetic disorder predisposes individuals to the development of multiple basal cell carcinomas, among other abnormalities. Hailey-Hailey disease, familial benign pemphigus. A genetic disorder that results in recurrent blistering and erosion of the skin, primarily in areas of friction, such as the armpits and groin. Stevens-Johnson syndrome, SJS, and toxic epidermal necrolysis, TEN. These are severe and potentially life-threatening conditions characterized by extensive blistering and sloughing of the skin and mucous membranes, often triggered by medication reactions. Epidermodysplasia verruciformis, EV. EV is a rare genetic disorder that makes individuals highly susceptible to developing flat warts and skin tumors caused by certain types of human papillomavirus, HPV. Xeroderma pigmentosum, XP. XP is a rare genetic disorder that impairs the skin's ability to repair DNA damage caused by ultraviolet, UV, radiation, leading to a high risk of skin cancer from sun exposure. Porphyria cutanea tarda, PCT. PCT is a rare type of porphyria that primarily affects the skin, leading to blistering, photosensitivity, and skin fragility. Necrobiotic xanthogranuloma. A rare disorder characterized by yellowish nodules or plaques on the skin, often associated with underlying systemic conditions. Acquired dermal macular hyperpigmentation. This is a rare skin disorder that causes hyperpigmentation of the skin without any obvious cause or underlying medical condition. Aquagenic urticaria, a rare condition where skin hives develop in response to water, even though it is not an allergic reaction. Because these conditions are rare, they may require specialized medical care and expertise. Diagnosis and treatment should be sought from dermatologists or other healthcare professionals experienced in managing rare skin diseases. Additionally, some rare skin diseases may have limited treatment options, making management challenging. What are the chronic skin conditions? Chronic skin conditions, also known as chronic dermatological conditions or chronic skin diseases, are long-lasting skin disorders that often persist for months or even years. These conditions may require ongoing management and treatment to control symptoms and improve quality of life. Here are some common chronic skin conditions. Psoriasis. Psoriasis is a chronic autoimmune skin condition characterized by the rapid overproduction of skin cells, leading to the development of thick, red, scaly patches on the skin. It can affect various parts of the body and may also involve the joints in some cases, psoriatic arthritis. Eczema. Atopic dermatitis. Atopic dermatitis, commonly referred to as eczema, is a chronic inflammatory skin condition that results in redness, itching, and the formation of dry, scaly patches on the skin. It often begins in childhood but can persist into adulthood. Rosacea. Rosacea is a chronic skin condition that primarily affects the face, causing redness, flushing, visible blood vessels, telangiectasia, and sometimes the development of pimples and swelling. Acne. While acne is often associated with adolescence, it can be a chronic condition that continues into adulthood for some individuals. It involves the formation of pimples, blackheads, whiteheads, and cysts on the skin. Vitiligo. Vitiligo is a chronic skin disorder characterized by the loss of skin pigment, resulting in white or light-colored patches on the skin. It can affect any part of the body. Hidradenitis suppurativa. Hidradenitis suppurativa is a chronic skin condition that leads to the Formation of painful, recurrent abscesses or nodules in areas with sweat glands, such as the armpits and groin. Lichen planus. Lichen planus is a chronic inflammatory condition that can affect the skin, mucous membranes, nails, and hair. It often presents as itchy, flat-topped, purple or reddish bumps. Dermatitis herpetiformis. Dermatitis herpetiformis is a chronic skin condition associated with celiac disease. It results in intensely itchy, blistering skin eruptions, often on the elbows, knees, and buttocks. Ichthyosis. Ichthyosis refers to a group of genetic disorders characterized by dry, scaly skin that resembles fish scales. The severity can vary from mild to severe. Seborrheic dermatitis. Seborrheic dermatitis is a chronic inflammatory condition that mainly affects areas rich in sebaceous, oil, glands, such as the scalp, dandruff, face, and chest. It can lead to redness and flaking of the skin. Neurodermatitis. Neurodermatitis is a chronic skin disorder characterized by thickened, itchy patches of skin that result from repeated scratching or rubbing of the affected area. Granuloma annulare. Granuloma annulare is a chronic skin condition that leads to the formation of raised, reddish or skin-colored bumps in a ring or circular pattern on the skin. Prurigo nodularis. Prurigo nodularis is a chronic skin disorder characterized by the development of intensely itchy, raised nodules on the skin, often resulting from persistent scratching. Pyoderma gangrenosum. Pyoderma gangrenosum is a rare skin condition that causes painful ulcers to develop on the skin. It can be associated with underlying medical conditions. These chronic skin conditions may require ongoing medical management, lifestyle adjustments, and adherence to treatment regimens to control symptoms and improve the patient's quality of life. Treatment options can vary and may include topical medications, oral medications, phototherapy, lifestyle modifications, and supportive care. A dermatologist or healthcare provider can provide a proper diagnosis and develop a personalized treatment plan for individuals with chronic skin conditions. What are the skin disorders common in children? Children can develop a variety of skin disorders, some of which are more common in pediatric populations. Here are some skin disorders commonly seen in children. Atopic dermatitis, eczema. Atopic dermatitis is a chronic inflammatory skin condition characterized by red, itchy, and dry patches of skin. It often begins in infancy or early childhood and can be triggered by allergens or environmental factors. Diaper rash. Diaper rash is a common skin irritation that occurs in the diaper area. It can result from prolonged exposure to wetness, friction, or irritants in diapers. Cradle cap. Seborrheic dermatitis. Cradle cap is a common condition in infants characterized by the formation of yellow, greasy scales on the scalp. It is generally harmless and often resolves on its own. Molluscum contagiosum. Molluscum contagiosum is a viral skin infection that causes small, painless, raised bumps on the skin. It is common in children and can be transmitted through skin-to-skin contact. Warts. Warts are caused by the human papillomavirus, HPV, and can appear on various parts of the body, including the hands, feet, and face. They are common in children and may resolve on their own or require treatment. Impetigo. Impetigo is a bacterial skin infection characterized by red sores or blisters that rupture and form yellowish crusts. It is highly contagious and often affects children, especially those in close contact settings like schools. Chickenpox, varicella. Chickenpox is a contagious viral infection that causes an itchy rash with small, fluid-filled blisters. Routine vaccination has reduced the prevalence of chickenpox in many countries. Hives, urticaria. Hives are raised, itchy welts on the skin that can occur suddenly in response to allergens, infections, or other triggers. They are common in children and can be acute or chronic. Ringworm. Tinea infections. Tinea infections, commonly known as ringworm, can affect the skin, scalp, or nails. They cause red, circular rashes with a raised border and may be itchy. Hand, foot, and mouth disease. Hand, foot, and mouth disease is a viral infection that primarily affects young children. It leads to the development of painful sores in the mouth, on the hands, and on the feet. Heat rash, prickly heat. Heat rash occurs when sweat ducts become clogged, leading to the development of small red bumps or blisters. It is common in infants and children, especially in hot weather. Allergic contact dermatitis. Children can develop allergic contact dermatitis when they come into contact with allergens in substances like soaps, lotions, or plants, example, poison ivy. Nummular dermatitis. Nummular dermatitis is characterized by coin-shaped, scaly, and itchy patches of skin. It can affect children and often occurs in the winter months. Pityriasis rosea. Pityriasis rosea is a viral rash that primarily affects older children and adolescents. It typically begins with a large, scaly herald patch followed by smaller, oval-shaped lesions. Childhood rashes. Various viral infections can cause distinctive rashes in children, including measles, rubella, and fifth disease, erythema infecciosa. It's important for parents and caregivers to be aware of common pediatric skin conditions and seek medical attention if a child develops a persistent or concerning rash or skin problem. Proper diagnosis and treatment can help manage these conditions and alleviate discomfort in children.